Hello there, my people. Hola, mi gente. ¿Qué tal? ¿Cómo están? I am very grateful to be here with you today. You'll notice I have a big one, a big pimple on my head. I just noticed that as I was doing this, but it is what it is. But more importantly, today I'm here to talk to you. You'll notice I've got my green on. I got my green background. My nails are kind of yellowy green. And it's a very important color this month because this month is Suicide Prevention Awareness Month. And so a lot of my videos and such and posts will be dedicated to the topic. We've got good news and not so good news, right? The good news is that by having a lot of these months on Mental Health Awareness Month, Suicide Prevention Awareness, this is good news, right? We're talking about difficult topics that a lot of people struggle with. And in talking about it, we reduce the stigma, people get help, and those are all wonderful things. Not so good is that the facts, and the facts are we are coming out of a pandemic and still under the influence of COVID and all that stuff. And with that, we've seen an increase in mental health issues. And because of that, we've also seen an increase in rates of suicide. Like the good news is there are certain groups, we've seen a little bit of a reduction, but there are also some groups that we've seen an increase. And so those are the facts. And so we do want to spend this month talking a little bit about how can you get involved? How can you make the most of this month? And so that's what I'm here today to talk to you about it, okay? So I would say first and foremost is become knowledgeable, right? When we're not so sure about something, maybe sometimes even the topic is a little scary, the best thing to do is just to get informed. And getting informed through reliable sources, right? Maybe we go to kind of academic journals, maybe we go to reliable websites, making sure that we are reading things about mental health so that we can maybe even start recognizing signs. If we see, if we know the signs, then we can really be able to identify those that might be struggling. A good book I usually recommend for people, Thomas Joyner is one of the kind of experts in the field. He's what's known as a suicidologist, which sounds very strange, but they are real. And it's called Why People Die by Suicide. Is one of his classic books by Thomas Joyner. And it just goes over all the kind of, what do we know? What are the risk factors for suicide? What are some of the theories about why people might die by suicide? Just a wonderful read. And like I said, there's lots of books out there. And so really educate yourself in that. And if you've got a DTF, I don't know where your brain's going with that, but I'm talking about a designated therapy friend. Moi, I'm always the designated therapy friend. We love to talk to you and help educate people. We feel really passionate about this topic and related topics. Approach me, approach your DTF, and ask the questions, right? Get knowledgeable. The second way to get involved and to help reduce some stigma is to reach out and touch someone. What do I mean by that? I mean, part of becoming knowledgeable is also being able to recognize some of the risks, right? If you notice someone has departed from their normal behavior or normal kind of mood, and you notice that they're maybe more sad, more quick to anger, maybe they're not sleeping as well, they become much more isolated. I feel really passionate about, be the friend that's going to ask the hard questions. Be the loved one that's going to ask the hard questions. Be the parent that's going to ask your child the hard question. Are you having thoughts of killing yourself? Right? How are you doing today? How is your mood? Tell me. How have things been? I've noticed you haven't wanted to hang out with us anymore. I've noticed that you're not doing, the things that you used to love to do. You're not joining us on those runs anymore. Be that person that's willing to have the hard conversation, even if that means sacrificing the relationship. It might do it in the short term. It might break the relationship in the short term, but I almost can guarantee that long-term benefit is that you might be helping that person, showing interest to that person in a way that nobody has. And so be the person willing to have the hard conversation. Remember, no one's expecting you to be somebody's therapist. So that's the fine line there. If you approach somebody with the intention from the place of respect, from love, support, willing to listen, that's it. That's all we want. Nobody's expecting you to be the therapist. If anything, you can just be the support to help someone know that they're loved, number one, and number two, potentially direct them in the right direction. The third way that you can get involved is utilize social media. We're in an era of social media, and social media does not have to be the enemy. There are great things with social media, and that can be a platform for reducing the stigma, a platform for awareness. This month, I challenge you to make a post, maybe checking in with people, maybe highlighting a local resource or highlighting an event that supports mental health issues, and letting people know that you're involved in that. So use your social media. Again, let's use our powers for good. And lastly, I would say is donate to an organization. $5, $500, $5,000. Organizations that support mental health awareness and suicide prevention typically are nonprofit organizations, and every dollar counts. I personally am on the board for one of our suicide prevention groups, nonprofits here in town, and that is part of my how I donate. And so I donate with money, but if you can't donate with money, you can also donate with time or donate with your gifts. Again, donate with raising awareness. Whatever it is that you can in some way get involved in an organization, that this is their platform, that is also a wonderful way, again, to be supportive, to reduce the stigma and get involved. So I am Dr. Nicole Peak, helping you here, not just to feel better, but to actually get better. And so now you know, wear your green. I want to see you. Take care. See you in the next one.